everyone, wishing you all a great day. I am Gayatri Anapampanjivan. Identification number is 980410045524. I am on my 5th semester in Open University Malaysia from Malacca Learning Center. This video is a task of my assignment, which is OUMH1303, English for Oral Communication. In this video, I will talk about my self-management during COVID-19 during the work from home period. Coronavirus. Coronavirus are a family of viruses that can cause respiratory illness in humans. They are called corona because of crown-like spikes on the surface of the virus. The new strain of coronavirus COVID-19 was first reported in Wuhan, China in December 2019. The virus has since spread to all continents. COVID-19 enters your body through your mouth, nose, or eyes, directly from the airborne droplets or from transfer of the virus from your hands to your face. The virus travels to the back of your nasal passages and mucous membrane in the back of your throat. It attaches to cells there, begins to multiply, and moves into lung tissue. From there, the virus can spread to other body tissues. The number of people infected changes daily. 196,910,000 people in the world have been infected. Over 4,850,000 people have died. While in Malaysia, 2,529,791 people are affected in COVID-19 until 12 November 2021. The total death until now is 29,576 until 12 November 2021 in Malaysia. Due to this situation, Government of Malaysia has implemented a multi-level movement control order MCO known as PKP, PKPD, PKPB since 18 March 2020 until now. Friends, during the movement control order, the staff has been instructed to work from home. Experts for the units involved in essential service such as finance, petroleum, security, and human resource. Other than that, the unit that does not involve have been instructed to work from home, including my own unit, which is management. Hence, many things have changed in my lifestyle, including adjusting time with work, home, studies, family, and my personal time. World Health Organization (WHO) defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. Broad in concept, it encompasses hygiene, nutrition, and lifestyle as well as environment and socio-economic factors. The COVID-19 pandemic has created a new normal that is nearly unrecognizable. For many of us, gone is the hustle and bustle of life, and simple things like running errands, going to school, commuting into the office, and spending time with a friend seem almost out of the ordinary. Now, our home is our office, restaurant, school, and hangout spot. Physical distancing guidelines have forced many of us to stay put, effectively blurring the lines of separation between work, play, and relaxation. Those of us who are used to working in a busy office, transitioning to work from home seems to be one of the biggest adjustments we have made. And there's been a steep learning curve. It's hard enough to find the right space in our home to work uninterrupted, especially if you share your space with roommates, a partner, or children. But now, our office and home are basically the same thing. You also need to step away from your workspace and take care of yourself. May that I manage for myself during work from home period is separate work and life. Work-life balance has taken on a completely new meaning. I dedicate a space to do my work that which is not my bed or bedroom. Studies show that working is in the space you normally dedicate to sleep can affect your sleep patterns, and that can be detrimental to your mental health. It's also important to try to separate work and home activities through the day. It can be tempting to use time between meetings to do the dishes or the laundry, but this can make it harder to separate work and life and lead to burnout. Ready, set, routine. Having a robust morning routine can be a game changer for our mental health. Take a shower, meditate, get dressed for the day. Establishing patterns will also ultimately help me to know when to log off, so I aren't taking my work with my bed. It's also beneficial to have a nighttime routine to make sure I not only getting enough sleep but ensuring that it's high quality sleep. Things like ditching my phone or laptop prior to bedtime and reading help signal the brain that it's time to start winding down. Breaks are my best friend. I have been working from home for a few months. Chances are more or less figured out what I works and what doesn't work for me. I always find ways to take care of my mental health even if I feel okay. Break my day up by going for a walk during lunch or work outside if the weather is nice. Block time off on my calendar so I can play with my cat for a couple minutes or meditate. Taking breaks is a proven way to increase productivity and help you relax, especially when work feels overwhelming. Stay hydrated and well fed. This seems obvious, but how many times do you step away from your computer, have a healthy snack, or take a sip of water? Some studies show that working from home actually makes us work more. So it's important that fueling our body while work. The kind of food eat also have an effect on your mental health. So skip the junk food and physically step away to give your brain a mini reset while you focus on something else. Try having lunch away from your computer. Friends, here are something that I follow to prevent from getting the COVID-19. First, vaccinated. Authorized COVID-19 vaccine can help you protect from COVID-19. You should get a COVID-19 vaccine as soon as you can. Once you are fully vaccinated, you may be able to start doing some things that you had stopped because of the pandemic. Face mask. Since August last year, the government has made it compulsory for people in Malaysia to wear masks even in public, with those floating the mandatory ruling liable to a fine of up to Rm 1,000 ringgit. Wear a multi-layered cloth face mask or medical certified face mask that fits snugly on your face and covers your mouth, nose, and chin. Avoid crowds and poorly ventilated spaces. Being in crowds like in restaurants, bars, fitness centers, or movie theaters put you at high risk for COVID-19. Your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, cough, and sneezing. It's especially important to wash before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing, and sneezing, after caring for someone sick, after touching animals or pets, after handling your mask. If soap and water are not readily available, use a hand sanitizer that contains at least 70% of alcohol. Conclusion: the pandemic of COVID-19 and adopting a lifestyle with new norm is a new thing for all of us. In this pandemic, the importance of health becomes number one of priority for everyone. However, the various methods and efforts I have managed myself and my family members to prevent from getting COVID-19. I and my family always will follow the advice and guidance given by the Ministry of Health. In addition, by separating work and life, set the routine, taking breaks, and staying hydrated and well fit had helped me a lot during my work from home period. Apart from that, matters involving myself learning as a student are not neglected, so that the level of development of my self learning is not disturbed. Other than that, methods related to my career will not be overlooked by ensuring all the instruction and guidelines from my superior followed for career achievement. Maintain good and consistent even working from home. As the saying, work hard first, have fun later, had become a principle of my life as where there is a will, there is a way. Thank you.